Hola and Happy New Year 2021. Welcome to Open, everyone. I'm Rhina Valentin, your host of Café con Leche for the next hour, encouraging you to get social with us online. That is, tweet us and follow us on Instagram at BronxNet TV and like us on Facebook at Open BronxNet Television. And of course, while you're there, follow moi on Twitter, FB, Instagram, LinkedIn at Rhina Valentin. In our new monthly segment brought to you by Essen Healthcare, we will continue providing knowledge related to health advocacy as we continue to deal with the pandemic. Let's get into our dose of essential medical information. This essential segment brought to you by Essen Health, we focus on the new COVID-19 vaccines. According to the New York Times, there has been almost 500,000 cases and nearly 26,000 deaths in New York City since the beginning of the pandemic. Although COVID-19 cases are increasing, finally, there are 2 COVID-19 vaccines that have been approved by the FDA. And so many people have concerns about these vaccines, and joining us to answer some of those questions, we welcome Essen Healthcare founder and chief medical officer, Dr. Sumir Sahgal, or as we endearingly refer to him, Dr. Sunny. Happy New Year, Dr. Sunny. Thank you for being here with us in the first episode of Open of 2021.
Thank you, Rhina, and Happy New Year to you and all your listeners. Thank you for having us on the segment.
Well, let's just jump right into it, right? It could possibly be a transformative year. And yes, there are these 2 vaccines. And unfortunately, there's a lot of mixed messages being put out there. And so let's just talk about the vaccines, how they work. I understand it's a 2-part process. So let's start there.
Absolutely. So, vaccines are meant to stimulate our immune system so we can form antibodies and they destroy the invading bacteria or virus that enters our body to cause that sickness. That's how basic vaccines work. So very fortunate that there are a lot of vaccines in the pipeline. Currently, we have 2 COVID vaccines approved. I agree with you, there is a lot of misunderstanding about the vaccine. So let me start by explaining how this particular COVID vaccine work. So the COVID vaccine has a piece of protein, not the virus, not the COVID virus, just a piece of protein, which has a message and is injected into our body through the upper arm. As it enters our body and enters the cell, it doesn't enter the nucleus, just the cell, and it tells our cell, gives a message to form a protein, a harmless protein called spike protein. And once this spike protein is formed, the message that is through the messenger RNA is destroyed, and this protein, this harmless protein that is formed, is pushed out of the cell and placed on the surface of the cell of our body. So basically, we have a cell with a spike protein on its surface, and basically that gives a signal to our body to form the antibody, the T cells and the B cells, which basically help to fight the virus, the COVID virus, when it enters our body. So imagine like this. We get a message through our weather channel that it's going to be rain today. So but we forget. But we go outside and we see somebody having an umbrella. And we remind us, oh my God, there's going to be rain today. So we go back and we get an umbrella. So that umbrella is like a spike protein. As this spike protein is seen by different cells, they make the antibodies. And when the virus enters the body, it helps to kill that virus. This is how this vaccine works. There are some misconceptions about this vaccine. Does it affect our DNA? It does not affect our DNA, because it doesn't enter the nucleus where our DNA is. It only stays in the cytoplasm, in the bigger part of the cell. There's a concern that I recently heard that, does it cause sterility or does it affect other body function? No, it does. It doesn't. There is no known effect on body functions as far as reproduction is concerned. And there was a recent concern that does it cause the COVID itself?
Right.
It doesn't, because there is no virus being injected. It's a harmless protein that is being injected through the vaccine.
So because you mentioned sterility, I wondered if it's safe for pregnant women to take it as well as children.
It's a great question. And the answer is we don't know for pregnant women because this vaccine has not been tested on pregnant women. Having said that, Moderna vaccine has been tested with pregnant animals, and it was not shown to show any side effects to the pregnant animals. Pfizer vaccine has not completed its studies, is conducting its studies right now, and the preliminary data shows that there is no effect either. So the best advice I can give is, if somebody's pregnant, they should talk to their primary care doctor and discuss it further.
So that brings me to the next question with regards to this two different vaccines, Moderna and Pfizer. So do people get to decide which vaccine they're going to take? And also, in addition to that, does the insurance play a role in which vaccine people are going to take?
We are a country of choices. The chances are slim that we'll get to pick the vaccine. And we do have two vaccines out there, Moderna and Pfizer. And the reason is because, one, it is provided free of cost by the government.
Okay.
So insurance has no role to play on which vaccine you will get. However, the healthcare facility that you get your vaccine from may have a charge for administration of the vaccine, which will be paid by the insurance. And if somebody doesn't have the insurance, it will be paid by the federal government under CARES Act. So there is no cost to the vaccine for all practical purpose for the people. Now, why do I say
the distribution of it? Wait, I want to make sure I heard that correctly. But the distribution of it is determined by the government based on whatever arrangements the healthcare, whatever facility and or provider it has with the actual vaccine decision making, right? I don't even know if I said that correctly. The idea is that while the individuals don't have that choice, actually nobody has that choice, is what you just said, right?
Well, you can't go to a Subway shop. You can't go to a Subway shop and ask for pasta. You're gonna get what they have the menu on. And the reason I say that people will have slim choices is because of two main reasons. One is the storage requirement of the vaccines. So there is a cold chain distribution required for distributing and storing these vaccines. And the Pfizer vaccine has an ultra cold freezer requirement where it needs to be stored at minus 94 degrees.
I see.
And the Moderna vaccine has also a cold storage requirement, but it can be stored in a regular freezer, which is minus 4 degrees. Most doctor offices, your neighborhood pharmacies don't have the ultra cold freezer available. Most hospitals have it, and that is why Pfizer vaccine has been distributed to the hospital first, and Moderna vaccine is what most people are getting right now in their facility. But there's one other requirement. That is why I say the chances are slim for choices, is because when people order, when the healthcare facility orders these vaccines, you have to order a minimum of almost 1,000 vaccines for Pfizer because the way it is packed. Whereas the Moderna can be ordered in doses of 100. So a big facility or hospital system would be requiring several thousands of them, but smaller locations, probably Moderna will be the one. So chances are in the community, it will be mostly Moderna.
Moderna. Okay, so that brings me to my last question with regards to Essen Health and how Essen Health is basically distributing the vaccine, and what are the qualifications for one to be one of the people being vaccinated right now? Because I know there's a level of priority, and what are those priorities that are being considered within the community? We get that the frontliners obviously should get it first, but within the community, how's that determined?
again, a great question. So we have almost all our sites approved for the vaccine. However, we have to follow the New York State CDC and New York City guidelines.
Mm-hmm.
And the government has set up a priority level for who gets the vaccine. So we right now are in priority 1A phase, which probably will last during this month of January. This is a time when healthcare workers, frontline workers, dentists, pharmacists, EMS, all those people who are dealing with COVID cases will be
Mm-hmm.
vaccinated. The next phase will be 1B, where people who are older than 75 will be vaccinated. And I, again, the government is changing its timeline depending upon the resources and their qualification. Chances are 1B will be towards the end of January or February. Then the phase will be 1C, which most likely will be March, April, where people between 65 and 74, along with the first 1A and 1B, will be vaccinated. And then comes this phase 2, where it includes everybody else. So that is expected in the summer of this year. Now, all these timelines can change based on the government recommendation and resources available.
Wonderful. Thank you. Thank you for your expertise and thank you for being here with us. Once again, that's Dr. Sumir Sahgal, Chief Medical Officer and Founder of Essen Healthcare. And you guys, if you want to learn more on the vaccination and or become part of Essen Healthcare, all you have to do is visit essenhealthcare.com. All right, we have to take a quick break, but when we return, we'll discuss achieving our, well, your New Year's resolution for 2021. Don't go anywhere.